Hello, my name is Lisa Deaton. I am a Louisiana Nurses Political Action Committee contributor and volunteer. As a nonpartisan organization, LANPAC is conducting interviews with candidates running for our state legislature. We want to learn more about where the candidates stand on issues important to nurses and to the health and welfare of the citizens of our state. LANPAC solicited input from nurses across the state, and then the Board of Trustees finalized the questions from the top issues submitted. These questions were sent to our candidates prior to the interview. I am delighted to welcome candidate Hugh Cassidy, who is running for the state representative position in the legislature for District 89. Candidate Cassidy, I'd like to turn it over to you now for a few brief remarks.
Thank you, Lisa. Hello, everyone. I'm Hugh Cassidy. As Lisa said, I'm a candidate for the House of Representatives in District 89. I am running on a resume of 37 years of business experience and 8 years of legislative experience. Prior to that, I worked for one U.S. Senator, one Congressman, and one state representative. And I served one term on a city council, which gives me more legislative experience than everyone else in the race combined. Business-wise, the last 2 decades, I've been in healthcare. I was a nursing facility administrator for probably 15 years and operated 4 nursing homes in that period of time. Had an exemplary record of surveys. And I also operated one inpatient rehab facility. About 6 years ago, I got out of inpatient care and went to work for the LSU Medical Healthcare Network. I managed a group of 4 inpatient clinics for them. I managed all of their orthopedic and sports medicine clinics. There was 3 of those, and one big multi-specialty clinic in the Ochsner-Kenner Hospital. So I've worked with nurses for the last 2 decades plus. I feel like a great relationship with all the nurses I've worked with over the years, because I've always realized I needed them more than they needed me. You know, I was trained to kind of run the business side, but not the health. And so I needed them to take care of my patients if I was to meet my goals. So, with that, I'll just take any questions you have.
Okay. Well, our first question has to do with healthcare disparities. We know prior to COVID, we recognized that healthcare services were not always accessible and equitable, both nationally and within our state. And COVID-19 just really shined a light on that issue. Healthcare is only 20%, though, of what accounts for one's health outcomes. The other is the social determinants of health. What strategies do you have to assist with reducing social determinants of health's impact on the citizens of our state?
A number of things. And again, I did not have a chance to get my little questionnaire out in front of me before this, but I believe in just improving the access to care, creating an environment with the I'm drawing a blank on the what you call it to make our state where full practice authority state.
Yeah. Okay.
I think that's going to increase access to care. I think it will also open up opportunities in rural areas and underserved areas. I would be in favor of doing whatever is necessary to promote full practice authority and opening up opportunities to expand care.
Okay.
Next question.
Okay. The next question is related to our faculty shortage. How would you advocate for federal and state funding to support recruitment and retention of nursing faculty, which would hopefully impact nursing shortage?
I would work diligently with Senator Kennedy and Senator Cassidy and Congressman Scalise in Washington to make sure the federal funding is there. And I would work nonstop in the Louisiana House to make sure there's funding in the Louisiana state budget for faculty at all our nursing schools at Southeastern and Delgado and from LSU, every nursing school that we have. I understand the nursing shortage because I was a victim of that many times. When I would lose a nurse, it would be very difficult to replace them. And that's one of the reasons that I learned very quickly that I needed to take good care of my nurses because I couldn't afford to lose any of them. So I always paid them well. I always treated them well. And I didn't lose a whole lot of them because of that. Next question.
Okay, the next questions are related to safety and violence. Gun violence continues to roar through our communities, in schools, houses of worship, shopping malls, outdoor gatherings, etc. What factors do you see as critical to bringing an end to these seamless acts?
I think we've got to start punishing the criminals. We've got to start locking them up. We have to, for repeat violent offenders, I would be in favor of holding them without bail until trial, and that's repeat violent offenders, not a first-time offender who's never been convicted. But if you've been convicted of a violent crime and you've gotten out on bail or gotten out on parole and you reoffend, then I think they should be held without bond until their trial. I believe that we need to do more to make sure that criminals or convicts, people convicted of violent crime especially, have no access to firearms. I do not, however, believe in limiting the access to firearms to law-abiding citizens. I believe in the Second Amendment and our right to defend ourselves. Next.
Okay. Rapid fentanyl test strips can be used to determine if drugs have been mixed or cut with fentanyl. With important information about fentanyl, healthcare providers can take steps to reduce the community risk of an overdose. How would you support legislation to make rapid fentanyl test strips available widely?
I would support full funding for that. That's one of the main things on my platform, is educating our kids on the dangers of fentanyl poisoning. I believe 71,000 deaths were reported by NIH last year in 2022. And if you do the math on that, that's about 200 deaths a day from this poison, which is another 9/11 every 2 weeks. And we went to war over those deaths. That was, those 3,000. And I think we need to go to war over these. Maybe not necessarily with the military, but we have to go to war against this poison that's coming in from China, the precursors coming in from China to Mexico, being made into fentanyl, pressed into pills. I went to the funeral of a young man whose mother worked for me at LSU Healthcare Network. She was a nurse. And he had gotten injured on the job and was prescribed Vicodin. When his prescription ran out, he tried to get more. The doctor wouldn't refill it, and he made the foolish decision to buy what he thought was Vicodin on the street. It was pressed into a tablet that looked just like the Vicodin, but it was not. It was laced with fentanyl, and he's dead. And his mother is still grieving, and his 3-year-old son's going to grow up without a father. I think this is a major, major, major issue. And if we can't stop it at the southern border, then I want to try to find efforts to stop it at the Louisiana state line. We all know it's coming in on I-10. We all know that. I-10 is a major, major artery for drug traffic all across the Gulf South. So I don't know yet how we would do it, but there's got to be ways to do it. There's equipment at the border we can buy equipment and have it at the state line and stop it from coming in here and save Louisiana's kids and save Mississippi's and Alabama's and Florida's and Georgia's and South Carolina's while we're at it. This is an issue that's very, very important to me because I have a son who has had struggles with opioid abuse. And I have sat up at night worrying that he's going to getting his hands on some fentanyl and we're going to lose him. Thankfully, he's clean now. So, but we live it day to day. So it's a very important issue to me. And I would always support full funding to get the test strips available to the public. Next.
Great. Okay, the next question has to do with access to care. And you mentioned in your opening remarks that you are supportive of full practice authority. So the question is, well, I just kind of said you already said that. But the question was related to, would you be supportive of actions to remove arbitrary barriers for full practice authority?
Yes, absolutely.
Okay. Okay, the last two questions are of a general nature. The first one is, what are your legislative priorities?
One of my first priorities is the fentanyl that we just discussed. Another priority of mine is for St. Tammany Parish is one of the highest. This doesn't really affect nursing, but St. Tammany Parish is one of the highest. The parish that sends the most money to Baton Rouge. We are not one of the parishes that gets the most money back out of Baton Rouge. So I want to work with Senator McMath in making sure that St. Tammany Parish is getting its fair share of the pie, because we've got serious infrastructure issues here in Louisiana, in St. Tammany Parish. We're growing at such a fast rate. I've been here since 1986, and it's a totally different landscape since then. There was never any traffic back in 86, and now you can't go anywhere without traffic. So getting the funding for St. Tammany, the funding that we deserve based on the money that we send in, is one of my priorities. The term limits is a big thing for me. I think that we say we have term limits in Louisiana. We really don't. I could serve 12 years in this House seat and then move to the Senate, serve there for 12, or I could just serve one term there, 4 years, and go right back to that House seat for another 12. Or I can serve 12 and sit out for 4 and go back for another 12. That's not term limits. I think that career politicians are a cancer on our country. And I think that we need to do something about it. I think 4 terms in the legislature, whether it's all in the House, all in the Senate, or a combination of the two, and you're done. You go home. That's the way this country was set up, I believe. I believe our founders wanted us to have citizen legislatures where you go, you serve for a season, and then you go home and you live under the laws that you created. I was mentored by a U.S. Senator named Paul Tribble from Virginia. Senator Tribble was elected to the Congress when he was 26 years old. He served 3 terms there, so 6 years, and then was elected to the Senate. And he served 1 term in the Senate and then voluntarily went back into the private sector. And I was his legislative aide for judiciary and national defense issues. I sat in those 2 committees every day, because he wasn't on them and he had to know what was going on. But on the weekends, I would volunteer to drive him around the state, because he was a Virginia senator. He could go home every night and be back in the state on the weekends, and he had to go to events. So I would volunteer to drive him because I wanted to pick his brain. And he mentored me on the difference between a career politician and a public servant. And that's what I want to be. For me personally, if I win this race, my plan is I will offer myself for reelection 1 time, and then I'll be done. I'll allow someone else to run. If everything's going perfectly, my senator, Patrick McMath, will term out in 8 years. maybe I'll run for Senate, but I'm not promising that unless everything's going really well and the people really want me to stay. I might run for Senate and serve one term there. But other than that, I feel like term limits are very important.
Okay. The
Next
last question is, why should Louisiana nursing community support you as the best candidate for District 89?
Well, I wish I could give you a list of all the nurses who have worked for me and let you ask them that question. I still have a long-standing relationship with a lot of the nurses that I've worked with over the years, again, because I knew I needed them and I knew what the work that they did, the dedication that they had, and I had a deep appreciation for that. And so I always treated them very, very well. I understand nurses. I understand what they go through. I understand the difficulties, especially when you're working round the clock after a hurricane. I've been through hurricanes. I've been through evacuations. I've sheltered in place. I've done all of that. I've worked where I had to wear scrubs to work to help bathe and shave the men because we didn't have enough staff after Katrina. I was in Franklinton for Katrina, so we didn't evacuate. We were on high enough ground and far enough inland, but we lost power for about 10 days. Had a very small generator that wouldn't power but a few red plugs and a few lights. But after going through that and passing water to my residents nonstop, having the hospital come hook them up to IVs, I just gained a deep appreciation for nurses and the work that they do. Real quickly though, after seeing that, I vowed that would not happen again. So I hired a political consultant. This is just a little anecdote of my thinking outside the box and being willing to do what I got to do. I hired a political consultant. I said, I hired Larry Kinlaw, who used to work for Governor Foster. I said, Larry, I need $100,000 to get a generator big enough to run this whole building. We're a nonprofit nursing home. We don't have the money to do it. I don't care if it comes from the feds or the state. So he drafted the legislation to amend the federal budget and the state budget. He said, we don't care where the money comes from. And I happened to be going to DC for a conference. So I went and met with Mary Landrieu and people from David Vitter's office, and Bobby Jindal was a congressman at the time. I met with some people from his office. We ended up getting the money from the Louisiana State House, our legislature, through the Washington Parish legislator at the time. He's no longer there, but his name was Doug Ritchie. We got the money. And when I went and testified before the House and Senate on the importance of this project, and once they saw how important it was, they decided they would make those funds available to any nursing home below the I-10, I-12 corridor for a certain period of time. There was a grant program that anyone could apply for and get those funds. So because I was just willing to think outside the box, I feel like I helped a lot of nurses, a lot of residents, but also the nurses that have to take care of them in the aftermath of a storm or any other disaster. But I know that's a long answer, but
no, that was interesting.
I think I have a very unique appreciation for nurses because of the career path I've taken.
Okay. Well, we want to thank you for taking the time out of your schedule today. And at this time, we'd like to give you a couple minutes to make any closing remarks on anything that you've covered or that you didn't cover in your previous statements.
Okay, well, thank you. Again, I'm Hugh Cassidy. I'm running on my resume only. I have more business experience than anyone else in this race. I have more legislative experience than anyone else in this race, and I'm the only one in this race with actual healthcare experience. I'm running because I want to make things better. I have five kids and 2 grandchildren, and I want to leave a better Louisiana for them than what we have today. again, I'm not trying to make a career out of politics. I've already had what I consider a really good career, and I'm kind of semi-retired now, and I have the time to give something back, and so that's what I want to do. I'm definitely not the most polished speaker in this race. I'll concede that, but I think I am the most qualified. I'm ready to hit the ground running and get things done on day one, because I have worked in the U.S. Senate, the U.S. House, and the Louisiana House, and I served one term as a city councilman. So I've got experience at the federal, state, and municipal level of working in the legislative body. So no one else is better prepared to take off and run with this job than I am. And no one else has the time that I do too. My children are grown. I have two opponents who have young kids they're going to have to leave behind to go to the session. I don't have that. I won't have kids waiting at home for me. I'm ready to go to work and roll up my sleeves and get things done. Thank you.
Thank you, and good luck with your campaign.
Thank you. I appreciate that.